Now, with our palpation, we're going to start with the test that we know is useful diagnostically for patellofemoral pain. And so before you palpate someone's knee with patellofemoral pain, you just want to give them a warning. So, Josh, I'm going to have a feel around your knee. What I'm looking for, so there could be some areas that, that do give you some pain. What I'm particularly looking for is whether it does give you pain, and especially if it gives you the pain that you normally get. So there'll be some structures that might just be tender in everybody, so things like particularly around the fat pad and sometimes in your patellar facets, but what we really want to know if Josh is feeling a similar pain to what he normally reports. Okay, Josh, so what I'm going to do first is feel through that medial patellofemoral joint. It is useful to put a small medial glide onto the patella when you do that, and then that just opens up the space there so that you can really get in and have a feel through that joint. Now, you may need to put quite a bit of pressure through there for your patient to be able to feel anything, but again, go very sensitively because in some people that area is really tender, and so you don't need a lot of pressure to be able to reproduce that pain. So similar to what we did for palpating the medial patellofemoral joint line, when we come to palpate the lateral patellofemoral joint line, we're going to glide the patella laterally and then really get in under that lateral aspect of the patella with your palpation. The other structures that we want to palpate around the knee are typically more useful for that differential diagnosis. So we're going to have a feel down through the quadriceps tendon, either side of the quadriceps tendon, so we're looking for any potential suprapatellar bursitis. We can have a feel over the inferior pole of the patella, so that's going to indicate potentially if there's any patellar tendinopathy, but also if we've got an adolescent with Sinding-Larsen-Johansson syndrome. We're going to feel along the line of the patellar tendon. So this is where, if someone's got patellar tendinopathy, this is really where they'll report their pain, so whether it's insertional or mid-substance. And then we're going to palpate down onto the tibial tuberosity. And so that's giving us information as to whether our patient's got Osgood Schlatters, particularly again in an adolescent.